Hello and welcome back to the On Farm podcast. It's Anna here with you as always. They say, don't they, that you learn something new every day. I'm not sure if that's true 365 days of the year, but it was certainly true on the day that I recorded this podcast. A massive, massive learning curve for me. And I imagine for most of our listeners, actually, unless you're particularly up with your science, then I'm sure you'll learn something in this too. We are going back to old friend of the podcast, Beth Wells from the Moredun Foundation, who is talking us through a particularly worrying illness, but one which she and colleagues are making a huge effort to get rid of. But before I hand over to Beth and our chat, I wanted to say a quick thank you, as ever, to our amazing sponsors, Scottish legal firm Gillespie McAndrew. I mean it when I say that this podcast would not happen were it not for our fantastic sponsors. So a big thank you once again to them for sponsoring this series. And of course, if you run a business or work in a business that you think might be able to sponsor, it's a good deal, actually. You sponsor us and we create awareness to all of the thousands of listeners of this podcast. So it's kind of a win-win situation. But anyway, get in touch if you can. But meantime, sit back, relax and enjoy the podcast.
Hello, I'm Beth Wells. I work for the Moredun Research Institute. So I deal with our main stakeholders, farmers, vets, moorland industry, and anybody else that needs any help from us.
Well, welcome back, Beth. And I say welcome back because you are not a stranger to the On Farm podcast. We've spoken to you before when we spoke about equine grass sickness and all of the work that's going on at Moredun regarding that. So thank you very much for joining us.
Thank you for the invite. It's lovely to see you again. Different topic, but, great to be here.
What are we here to chat about today?
The topic of interest for me at the moment is a disease called Louping-ill in sheep, predominantly, but also in red grouse. Now, Louping-ill is a horrific disease. It's a neurological disease which is caused by the sheep tick. So it's transferred by infected ticks onto all mammals, really all warm-blooded creatures. They're not fussy about where they feed on. But unfortunately for us, both sheep for the livestock industry and red grouse for the moorland industry are highly susceptible to the disease. So when I say it's a neurological disease, the symptoms are horrendous. It's of high animal welfare, high concern to both farmers and moorland owners in that you get large losses, particularly where the virus is first encountered.
So as it stands then, at the moment, the fatality rate is pretty high. Is it for all animals that are affected by this?
So it's a complex disease and this doesn't really help. But yes, if a farm, for example, gets Louping-ill in the sheep where they haven't seen it before, because the sheep will mount an immunity to it after they've seen it if they survive it, losses can be up to 50, 60% in a flock. It's horrendous and really devastating for the farmer. And I think we have to keep in our mind too, is that this is a horrible disease for the farmer as well as for the sheep. So I've had farmers describe to me about going out in the morning, not knowing how many more dead sheep there are. It suddenly hits them. They can go out and just have, half a dozen or more dead sheep and they don't know why. So there are good diagnostic tests. But that requires obviously a blood sample or taking the carcass for PM. So there may be a few days before the farmer will get a result from this. And meantime, they're losing sheep, which is economically drastic, but also mentally very hard on the farmer.
And as a neurological disease, for me, the untrained observer, that sounds to me as though it's a pretty nasty disease as well, and that the sheep are dying a pretty unpleasant death.
Oh, yes, that's very safe to say. If they get to that stage, then yes, it's tremors, uncoordinated movement. They can't really control where they're going. There can then be convulsions, coma, death for the animal once it gets to that stage. Once it gets across the blood-brain barrier, then there's no saving the animal, unfortunately. This is why we need to look at prevention.
Absolutely. And that's effectively what we're here to talk about today. Just before we do, I'm guessing the same applies then. You mentioned grouse. The same applies to grouse, large losses. Obviously, that has a large financial impact on shooting estates and people who rely on grouse moors for their income. So this is an issue or disease that's affecting the whole of rural Scotland almost, because it's impacting upon sheep farmers and grouse moors, and that between the two of them, they're covering an awful lot of our rural landscape, aren't they?
Absolutely. If you look at the sort of surveillance maps, and surveillance is another completely different and difficult issue with Louping-ill, but if you look at the maps that we do have of reported cases, virtually the whole of Scotland's covered, and all of the upland areas of England. So it's not just a Scottish disease. So we have all the upland areas of England now seeing cases, and also in Wales. And also we have cases in Northern Ireland. So it's a UK disease. In terms of the grouse, it's a difficult one again, because it tends to affect young grouse that will not have any immunity to the disease. And so therefore it's just chicks that are hatched but then don't make it through. So difficult to tell. You can have sort of positive diagnosis on adult birds that are alive, and that's good because that means they're immune. But it's the devastation to the chick broods, to the numbers that are coming through, that is really difficult, and difficult to assess for the keepers as well.
This is all the depressing stuff, but we have something pretty positive that we're going to come on to in a minute. But before we do, just to clarify, am I right that humans can contract this disease, but that's not a huge issue? Is that right?
That's correct. It's what we call a zoonotic disease, so it can be passed from the tick to humans as well. And indeed it has been. There have been reported cases of this, but you're right in saying it's not common. But there are lots of other species it's not common in that we're actually seeing increased reported cases of and unreported cases of. And we had a big discussion about this just yesterday, in fact, is in dogs.
Right.
So we have an increase in sort of anecdotal and reported surveillance cases in mainly working dogs on moorlands. So we're talking Labrador retrievers, spaniels, working collies, foxhounds. So these have been the sort of cases that have been documented, but I know that's just the tip of the iceberg from talking to gamekeepers and people that are, and farmers and folk that are involved with dogs. So dogs is something we're really keeping our eye on. The other one is cattle. So cattle are less commonly affected than sheep, but we're seeing increasing reports in areas that are really coming under fire from Louping-ill. So I'm talking about areas like Dartmoor, where we're doing an awful lot of work with the Dartmoor Hill Farmers Group. And they're reporting losses in bulls, cattle, and horses.
Gosh, right.
So we do need to keep an eye on all of those other species. And, you know, where are the main reservoirs of the disease? Where do the ticks actually get the disease from? And the main culprits there are the animals that have a viremia response. So basically they can ramp up the virus in their blood circulatory system that the tick then gets access to. So these species would be sheep and red grouse primarily. There are some co-feeding, some evidence of co-feeding in mountain hares. So when ticks attach at the same time, if one is infected and one isn't with Louping-ill, the co-feeding tick could become infected.
I see.
So there is some evidence of that. And then we have other forms of wildlife and indeed livestock that are just tick carriers. So for example, it could be, you know, wild ponies. It could be from herds of wild deer. We know deer are big tick taxis, and they, of course, can roam large distances. And this is how we think the disease is spreading, as there's no checks at the moment. There's nothing that we can dampen down the viral loading on moors or farms at the moment.
Yes. And once an animal, be it a sheep or a dog, say, has the disease, is there anything that can be done to try and save it? Or is it just a matter of wait and see? And as you say, you know, you've got a sort of 50% chance of survival.
So the disease manifests itself quite differently, I think, depending on the viral load the animal gets in the first place. So if, say, the animal just gets a very low viral load from one tick, say, for example, the sheep may be able to form a sort of immune response and then have a natural immunity and survive. But if they either have a high viral loading or the sheep is unwell for any other reason, and one of those reasons that we're seeing quite frequently is tick-borne fever. This is caused by a bacterial disease from Anaplasma. Now, that can just cause the immune response of the sheep not to be so strong. So the sheep, if it gets both at once, certainly will probably get full-length disease. And quite often the farmers in that scenario will just find a dead sheep or lots of dead sheep.
I see.
There's not anything really in terms of treatment that's going to stop that once the disease is progressing. And certainly once it gets to the neurological stage, then no, there's nothing that can stop it.
No. So under different circumstances, this would be 100% depressing and miserable, wouldn't it? But the Moredun Research Institute are involved, and I know from previous experience that where they are involved, there is always optimism. So tell me a little bit about how that optimism is starting to emerge and what you have been doing as far as that journey is concerned.
I love it, Anna. I'm going to recruit you to the Moredun board. Yes, absolutely. So a little bit about the history here, because obviously, as you'll know, we were set up by farmers. We still have farmers and vets on our boards. So we're very much tuned in to responding to what the industry needs. So if an industry tells us they have a problem, then we would prioritise that to gain research funding to look into it for them.
Mm-hmm.
Now, on top of that, Moredun has a history of developing Louping-ill vaccines. So we have had vaccines in the past. So it was one of the first vaccines that was actually produced by Moredun in the 1930s, actually. And it was a very crude vaccine.
Wow, I didn't know that.
Yeah, it goes way back because it's a very old disease. And that vaccine in the 1930s was a very crude vaccine, really using sheep's brains and spleen. It worked very well, but obviously it was a horrible vaccine to make. It wouldn't pass the tests nowadays that we have, obviously. But it worked well at the time. And my father was a very young shepherd at that time on a farm with Louping-ill. And he said to the day he died, this was the best thing that Moredun's ever done, was that vaccine. It saved more lives than any other vaccine. And, you know, we've been involved in lots of different vaccines, the Clostridial, Heptivac vaccines and Toxoplasma vaccines. But this one on a hill farm probably saved more sheep than any.
Wow.
But, you know, things moved on. It came to the 1960s. The scientists at Moredun were already using newer technologies to improve the vaccine, to go to a more modern type vaccine. That vaccine was launched in the 70s, and that was it was still using virus. It was still risky in that the scientists had to grow up these viral stocks. Then they killed them and put them in a vaccine. So it didn't involve sheep, so that was good.
Right.
But it did involve the scientists being exposed to live virus for a start.
So both of the vaccines then presented quite a risk to the people who were developing them. That was kind of
exactly.
That was the downside of the wonderful science, I guess.
Exactly, and they were using, you know, the latest technologies they had available at the time. But the other problem with the last vaccine was that sometimes the viral stocks failed, so then there'd be no vaccine that year. So that wasn't great because supply wasn't reliable and it was very expensive to manufacture also.
Yeah.
So that was discontinued in 2017 and we knew then we were in for trouble because we didn't have a vaccine ready, obviously, because we didn't know what was going to happen. But Moredun being Moredun, were very, very quick onto it. And we had some Scottish Government funding in our Scottish Government funded programme. And they are, I should say at this point, they are really critical to our research. We were able to develop a different type of vaccine. So it's called a recombinant vaccine. So that's using synthetic proteins. And the lead scientist at Moredun, Dr. David Griffiths, was instrumental in this with his team. I had a chat with David and we realised that we needed to do some quite expensive vaccination and challenge trials when he realised he had these viral particles that sheep were responding to and producing an immune response. Now, these viral particles have no DNA content, so they're non-infectious.
Okay.
So that was a huge step forward because we've now got something we can grow in a lab, you know, at no risk.
I see.
And forms a very safe and easy to manufacture vaccine. So that was a big game changer. And at that point, I spoke to a very good colleague in the Game and Wildlife Conservation Trust, Dr. Adam Smith, who's now sadly retired, but he was instrumental in pooling donations from Scottish estate owners and also some estate owners in England and organisations such as the Scottish Gamekeepers Association to fund this work. So this was very expensive work because we were vaccinating sheep and then we're putting them into our high security unit and we're challenging them with Louping-ill. And we could show that the vaccine protected all of those sheep that were challenged against Louping-ill. There were no signs of disease at all. So we have a vaccine.
And we need to talk about that because we need to talk about how it's going to develop, but more importantly, how it's going to be viable and be put to use. Can I just take you back a little step? You said that the previous vaccine was discontinued in 2017. So that left you with no vaccine in 2017. Did that then lead to a spike in terms of cases that were being seen?
So this is a really interesting one, Anna, and I can't answer you completely, and I'll tell you why. It's because the surveillance is so difficult for this disease.
Right.
So we're talking about primarily, I should say, because we are actually now seeing it in lower farm ground as it spreads, but primarily it's been a disease of the hills, uplands, moorlands. So the sheep are out there and they may not be seen.
Yes.
So particularly when they gather in at the back end, those lambs, for example, that aren't gathered back in are counted as part of a black loss. And traditionally, black loss, depending on the farm, has been 10 to 30% sometimes.
Yeah.
And farmers just have to accept that because of where they're grazing sheep. Now, those that are reported, of course, go into surveillance, but it doesn't really show us the full picture. It doesn't really even show us the full picture of the spread of the disease. But what we do have is we do have red grouse surveillance, and that has been very useful. So what happens is, and increasingly the estates are doing this, at shooting in August, they will put birds into Moredun to be tested. So basically, Moredun with SRUC, our Scottish surveillance network. And so the team there, the viral surveillance unit at Moredun, will test these samples. So we have an idea of not only where the disease is in Scotland and north of England from this, but we also know the prevalence. Is it increasing? And on recent data, it's been increasing year on year. Now, I haven't got the bang up to date data, but I just heard yesterday from GWCT that their testing this year would show they have another increase in prevalence.
Right. So Super Moredun is coming to the rescue. And that's really why we're here. As you said a couple of minutes ago, there is now a vaccine. There is a new vaccine. But tell me about the barriers that are now being faced. Yes, a vaccine has been developed, but what needs to happen next for it to actually be used and to address this increase that you just mentioned?
Yes, so this is the important bit, really. We really come to the crux of the matter. So we have this research vaccine that we know is effective. So our next stage would be to hand that over to a vaccine producing company, so a pharmaceutical company that does exactly that.
Yeah.
Now, what we came up against at this point is, well, for one, Louping-ill is a UK disease. But I think we need to get over at this point that for the farmers that have it and it's spreading, so even if they don't have it, they could well have it if we can't stop this, it's a disaster. So although financially it didn't suit the companies to invest in it, so to get a vaccine to market is highly expensive from the research to the on the shelf. It's very expensive. And because it's a UK disease primarily, and because all of these companies are now global companies, it just didn't fit in.
I see, yeah.
And also, sheep vaccines have been difficult. Everybody's sort of heard of this recently, of the issues of getting a hold of clostridial vaccines, of Toxovax. These are real challenges to sheep farmers because they're seen as a low value. And we know sheep prices are very buoyant. They have been for the last few years, and they are again this year. So to the farmer, these animals are really valuable. But unfortunately, we're lagging a bit behind that in industry.
Yeah. So the crux of it is that the pharmaceutical companies, it's not they don't believe it's financially viable for them to take it forward because in global terms, it's a small issue for them.
Exactly that. It's a small market.
So what are we going to do to combat that then, Beth?
Well,
I say we because I'm already feeling heavily invested in this.
Brilliant. Absolutely. So At that stage, normally it would be dead in the water.
Right, gosh.
It just wouldn't happen because that's not what we do. We're not a commercial company. Moredun is run as a charity, and we're a research institute. However, with backing from our amazing CEOs, initially Professor Julie Fitzpatrick and now Professor Tom McNeely, I got the support to push it forward just to see what we could do. Can we get it any further forward? Now, this is well out of our expertise, you'll realise, because again, it involves a whole different skill set. It was actually Dr. David Griffiths, who had developed the vaccine, was talking at a meeting of avian vets, actually.
Okay.
And he met a director from a young company called Kernfarm. And Kernfarm are originally a Dutch company, but they've got a sort of base in the UK now. And they're very keen on developing solutions. And they could see that within the UK, we have an issue with sheep vaccines. And they wanted to help. And basically, that's what they're doing. So they have the expertise that we don't have. They haven't the size that they can take it on and run with it at this stage. But they have the expertise in our regulatory procedures through the Veterinary Medicines Directorate, and they've been instrumental in helping us there.
Right, yes.
And they also have the expertise in manufacturing organisations, so getting organisations that can actually manufacture the vaccine for us. We've made great strides. We approached what we call the VMD, the Veterinary Medicines Directorate. We've had really good conversations with them. They've been incredibly helpful in indicating that this vaccine is eligible for limited market authorisation. This is LMA. This makes the process much cheaper, much shorter for us, so we don't have to go through massive field trials with the vaccine.
Okay, yeah.
So that was another green go light. So we all got very excited. Oh, green go, off we go again. And at this point, we brought in our business development team at Moredun, and they have been incredibly helpful at setting out a sort of funding development plan of how we can get this vaccine, what it will take, what it will cost, who we need to help us, right through from where we are now to getting this vaccine on the shelf. So we're working with Kernfarm, with our business development, and with lots of other experts within both the livestock and the moorland industries, we developed this funding plan, which is what we're now rolling out right now. So this is really well timed, this podcast, actually.
Yeah. So we're talking about crowdfunding here, aren't we? And I understand that this crowdfunding campaign that you're about to tell us about is the first of its type in terms of fundraising for a vaccine, which I think is it's exciting and incredibly novel, and actually just quite frankly a brilliant idea. So tell me a bit more about how is it going to work?
Yes, it's incredibly exciting. And you're right, we do believe, I stand to be corrected, but we do believe this is the first time a vaccine, certainly in recent history, has been funded this way. And I think it's really important because we're looking at the two major upland industries in particularly Scotland and Northern England helping each other here. Now, how it's being rolled out, it's in process, really. So we cut it down into phases. So we had 3 phases, which really fitted in with the manufacturing process of the vaccine from now on in. Mm-hmm. And also, it didn't look quite as daunting if we had it chopped into 3 phases as we did.
Always break everything down into pieces. Yeah, definitely.
Yes. So the first phase is really our manufacturing transfer. So we take the vaccine from the research lab and we put it into a contract development manufacturing organisation. So they're really important because they're doing this all the time. They have the facilities to ramp up the vaccine production into a commercial product. And at that stage, then it has to come back to us to be tested to make sure that vaccine is as safe and as effective as the research vaccine was. So that's basically phase 1 and the beginning of phase 2. Phase 2 is all about the safety efficacy trials, the dose determination, and also putting together of the regulatory dossier, which Kernfarm are very much involved with. And this will be the dossier that the VMD require to license the vaccine so it can actually be sold as a commercial vaccine.
I see. Yeah.
So that are the first 2 phases. These are donation phases. In total, they will cost about 2.2 million. just eat quickly.
Ooh.
It's a lot of money. We are a charity which has helped. So we can be donated to through charitable trusts or, and just giving. So that's been really important for attracting funding. And then we've got phase 3, which is very much our investment phase. So phase 3, at the start of phase 3, the VMD scrutinise the dossier. If everything is okay with them, if they're happy with all the checks and the trials that we've done, then we get the green light. And then that's it. We start commercial manufacture. And phase 3 involves also the distribution and marketing of the vaccine. So that's to get it on the shelves in the vet surgeries to where it's needed.
And actually, that sounds like a lot of money, because it is a lot of money. But I suppose when you compare it to the potential losses on farms and estates, it's really not a lot of money. Those losses would make that number pale into insignificance. And so that is where the value lies, I guess.
That's exactly right. We're talking about over 5 million for a completed job to get the vaccine in the vet surgeries. And I think, because our driving force is to support our hill and upland farmers, Moredun aren't taking profit. There's no profit involved here. We're doing this, it is dead to cost.
Yes.
So that's the way it's being run. So actually, that comes in well under what most vaccine production figures would look like.
If you'd asked me to do a very uneducated guess, I would have come up with a figure of a lot more than that, actually.
I think that's fair to say, because again, like all our time for the huge effort that's gone in, and across Moredun, that's involved so many teams of people, from science to communication to our senior management to business development, finance. It's been critical. It's involved all these people at quite a high level, and also for Kernfarm, they have directors scurrying around getting information as for us to be able to progress. So from both sides of this coin, there's been a huge amount of input. And also we have other external stakeholders also that I can come on to, who have given us hugely of their time and expertise. So for that, we're incredibly grateful. It makes us think we're doing the right thing, I really do have to thank Scottish Government, and I'll come back to Scottish Government on the donations theme, but they funded the initial work here. And also the Scottish Estates and the Game and Wildlife Conservation Trust Scotland, who were instrumental in that initial work, along with Dr. David Griffiths and his team. So that was the first set of work that gave us a research vaccine. And without that, we wouldn't be doing this. Absolutely not. From then on in, there's been so many people, but external to Moredun, because I think I've probably mentioned most of the Moredun team. We have Ross Ewing, who's at Scottish Land and Estates, Director of Policy. Ross is an absolute firebrand. He has been everywhere and all over this for us, helping us get access to estates, to moorland group meetings, speaking to keepers, speaking to estate managers and owners, along with backup from Hugo Straker, who is now a game consultant. He is ex-Game Wildlife Conservation Trust. Hugo spent a huge amount of time in the field, knows everybody involved in the moorland industry in Scotland. So our farming networks have stood us in good stead for the farming side. Without particularly these two people, we wouldn't have got any further.
Yeah.
And backing up Ross and Hugo, we have the moorland groups who have got me access to all of their meetings. We've got people like the Earl of Hopetoun, Andrew Hopetoun from Hopetoun Estates, who's been absolutely free of his time and advice to help us get this forward in the best way suitable for the people we're targeting. And also Robbie Douglas Miller from the House of Lords has also become very involved, hugely helpful. And they've got such a vast experience of this industry, and they really are leaders within their industry, that I am absolutely humbled by these great people, chipping in to help us. And then there's lots of there's the farming groups I particularly would like to mention are the Dartmoor Hill Farming Group, led by David Atwell.
As you have said, this is not just a Scottish issue, this is a UK-wide issue.
Exactly. So David Atwell from that group has been particularly proactive at pushing the vaccine to DEFRA, to ministers, because they are having massive issues in Dartmoor with it. So we're in conversation with David frequently. Also the Exmoor Hill Farming Group, and similar in the North York Moors. And I should also mention Dan King, one of the Sandhill vets, who again has been hugely supportive. They are avian vets, very heavily involved in grouse management. And also Matt Colston from Elanco. He's a ruminant vet from Elanco who's been massive support in putting out the message of why we need a vaccine, why we can't just rely on a caricidal treatment to control ticks, why we need the vaccine in conjunction with that to keep these products working well.
Yeah. You would love support from anybody involved in sheep farming, but also estates throughout the UK for whom grouse is a key income stream. So we ask anybody who fits into either of those categories to please get involved. But how and when can they get involved, Beth?
Well, they can get involved now.
Oh, even better.
It's up there, yes. It has got its own page on our website. So it's on our website, moredun.org. You can type in Louping-ill fundraiser. It will take you to the page. It's done through the Just Giving or directly into our Moredun Research Institute bank account or by QR code. So we've got QR codes on all the literature that goes out about the vaccine.
Brilliant.
So there's various ways to donate. We launched it at the Highland Show this year at our famous wine reception on the Friday afternoon at the Highland on the Moredun stand. And we invited along to that quite a few of our policy colleagues that we always do. So we had Marie Goujon, with Jim Fairley, MSP. We had, various other policy, Sheila Vois, a chief vet. And we were talking about the Louping-ill vaccine and what we're doing with it, how we're hoping to do this crowdfunder. And about 10 minutes after that, Marie Goujon got hold of a microphone and announced that Scottish Government were donating 1,000k match funding, just like that.
Wow.
I know. I've just been told it's the only time they've ever seen me speechless, but I was just absolutely blown away. I just thought that is policy at its best to me.
That's 100,000, did you say?
Yes.
Oh, brilliant.
So it's match funding. So when we raise 100,000 from industry, Scottish Government will give us, but it has to be done by the end of the year. So we're on it. We're saying no donation is too small. We've had £2, £5, £10, £20, right up to our biggest donation to date is £10,000 from the farming industry.
Wow.
So we're just asking people to consider it and give what they can afford. And I really hope it'll go beyond farmers that have got the issue into the whole farming community, because just if you don't have it now, we're watching it spread. It's spreading with ticks.
Yes.
And it's unchecked because we don't have a vaccine. So as long as ticks are spreading, Louping-ill will spread with them. So we are appealing, and the National Sheep Association have been very helpful here in putting out in their literature, but we're appealing to the whole of the UK farming industry just to give what they feel they can afford. You don't have to have the disease. It's much, much more open than that.
In my opinion, if you enjoy roast lamb on a Sunday, that means you're part of the Scottish sheep industry indirectly. So you're just as eligible to give £2, £10, £20 as anybody else. I think we all have a responsibility to support the industry in order to enable it to keep delivering what it is that we enjoy on our plate. The Scottish sheep sector exists because we as a country enjoy lamb mince or a roast lamb. We have to show support for that sector. And it may be that a lot of people listening, it's never occurred to them that that's the kind of support the sheep sector needs. And then talking about the estate sector as well, that delivers so much back to the economy in terms of a whole host of things from, shooting and other country sports, but also in terms of the delivery of, self-catering accommodation and so much more besides. So they need and deserve the support of ordinary people as well as inter-industry support.
Yes, absolutely. So I'm really glad you brought up consumers, actually, because I think we tend to think that hill sheep aren't producing anything. But when you look at what hill lamb contributes to the whole sheep industry, the sheep industry in the UK, as you know, is highly stratified. And that starts with the hill sheep. So apart from producing very nutritious, lean and healthy lamb, it is also keeping people in the hills, keeping access to the hills. If you don't have sheep, you just get a wilderness. Access is important, food is important, communities are important, and sheep farmers provide all that, as well as providing the basic stock for the crossbreeding industry. So low ground farmers rely on hill farmers. And we know sheep are going off the hills, and this is something we would really like to see halted. And if this is what they need, then I absolutely agree. If consumers feel they can add that support because they enjoy their Sunday roast or just because they like farmers where they are, then, I think that's also an important message. In terms of the moorland industry, I think it's exactly as you say. The moorland industry support a huge number of jobs and resources and put a huge amount of money into that and private money into that. So again, supporting them for me is also very important because they're part of the rural scene. And I think both industries support each other. So if we're looking at sheep grazing moorlands, the shooting industry like that because sheep are the only animals that we can control tick on. So they could be used as the ability to kill tick because they've got a caricidal treatment. And that, again, that's very important. But also in terms of grazing, the sheep graze well with the grouse. So it works. It's a system that works very well and it has obviously been in place for a long, long time. So if I can support both industries by doing that, then I'm very happy.
So that is the message, I think, really, isn't it? This is a novel crowdfunding campaign, but actually a genius way in which to deliver something that is much, much needed and that will save a lot of heartache and a lot of financial loss for farmers. And therefore, anybody who's got any kind of interest in rural Scotland, whether that be sheep farming, lamb consumption, supporting rural estates, it's relevant to you. So if you can, please click the link in the show notes and donate something to the crowdfunder.
And also, I think too, Anna, we should add to that, dog owners.
Yes.
Anybody's dog can pick up tick. I don't want to be scaremongering at all, but the reality is we are seeing increases in disease and fatalities there. Dogs, we have pretty good products to cover them, but I think the scariest thing for me was these dogs, well, the ones that were reported and died through the vets, were covered for tick.
Yeah,
they actually had current tick treatments on them. Now, horses, there's nothing actually registered for tick in horse. Some people use cattle products.
No, and I just learned that recently because I was looking it up. When I was treating my dogs, I thought, I never treat the horses for ticks and I wonder why. And then I did my research and found out. So actually, yes, just as relevant for horse owners as well.
Absolutely. And cattle farmers, as I say, we're seeing it now in cattle as well. I think this campaign is going to take a while. We're being watched with interest. The British Veterinary Association have phoned me to say they're really interested in what we're doing. They really hope it'll work, but they're watching because it's such a novel approach. And we have this issue across the sheep vaccines. And also we have a landward showing on the 16th of October, if I can give that a plug, please. So they became interested through dog ticks. Then they talked to us about the vaccine. So we introduced them to the vaccine topic, and they actually went onto a farm and did a case study with one very supportive farmer, Ian Duncan Miller, who I should actually also thank sincerely. He's done such a lot of legwork for us using his farm as a case study. Ian got Louping-ill for the first time in his sheep flock a few years back, and he lost over 70 sheep. And Ian is a very, very good sheep farmer. But it was horrible, and we supported Ian as much as he could. And I just realised then it hits all farmers. You can be as good at stock keeping as you like, but if it comes in via whatever route, there's not much you can do at the moment.
Yeah, it does not discriminate.
Yes, I think that is the message, is that, we need to appeal to as wide an audience as possible. We really do need to make this work, and I might get my P45. So, yes.
Well, I'm hoping that in a very small way, we are able to help you not get that P45 by helping to spread the word.
Oh, that's really supportive, Anna. We really appreciate it.
So, as I promised, a bit of a learning and educational episode there, but I hope you enjoyed it. I certainly did. You'll find a link to the fundraiser in the episode description. So, particularly if you're a sheep farmer, or even if you're a meat eater and you enjoy your roast lamb, or just somebody who enjoys the countryside, I know that everybody would really appreciate if you would consider supporting. The episode of Landward on BBC Scotland, which Beth also mentioned, about the impact of Louping-ill and the development of the vaccine, is also available, and we've put a link in there to the episode description. As usual, before I go, another quick thank you to Scottish legal firm Gillespie McAndrew for their generous sponsorship. And I will be back. Our new routine is episodes fortnightly during school term time, so I'll be back again soon.
Produced by Bespoken Media.